Carmel, Hauck. My student number is T00701793. This is my clinic mentor, Roberta. So today we're doing our COHAT. He is a nervous caution, so we weren't able to do his anatomy exam before anesthesia, but now that he's safely anesthetized, I know I'm going to miss out on the occlusion. That's okay. I'm just going to examine the extraoral and intraoral portion now. So as far as his face goes, it's symmetrical. I don't feel any masses. I don't feel any bony changes. I don't see any muscle wasting or atrophy. He would be called a mesocephalic breed. He has a longer snout than most, but he is within the mid-range. And then as far as our intraoral exam, I'm just going to take a minute to look at his gums. Again, checking for any masses, abrasions, or lesions. I'm making sure to check all the surfaces of the gums. I'm going to look at the tongue. I'm just looking at all surfaces underneath the tongue. And then the palate as well. There's no abnormalities on top of the palate. And then when Olivia was intubating, she didn't find any abnormal structures there either. So now we're going to flip into lateral and do our charting. Okay, so I'm going to start my charting by counting the teeth and looking for any missing or previously extracted teeth. So today I'm going to be doing the buccal 100s and then the lingual 300s. So I'm just going to be charting the 100s for now. So he has 101, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then on the 300 arcade, we have incisors 1, 2, 3, 303. He is already missing 304, the canine, 305, 6, 7, 8, 9, 10, and 11. So he has full dentition aside from 304 is already previously missing. So I'm going to circle that on my dental chart as missing. Now I'm going to go with my probe, and we're going to be looking for any pockets under the sulcus of the gingiva. So I'm going to take my Explorer and I'm going to run it under the gum line, looking for any pockets. And I'm just going around the entirety of the tooth. So on this canine, he has a 3 millimeter pocket, but anything more than that we're worried about in dogs. So for the 3 millimeter, I'm not concerned here. He has a fairly large pocket again on the 05, but it's not more than 3 millimeters. Same on 107, a 3 millimeter pocket. Oliver's here for Dr. B. So on the buccal 108, he is bleeding with probing, and it's more than a 3 millimeter pocket. I'll call that a 4 millimeter pocket. So I'm just going to chart that. And that's on the buccal side of the tooth. And then I'm going to go back to my 300 sides too. So this side is very nice. The only thing I have is a bit of a 3 millimeter pocket on the lower 309, but there's no bleeding with probing. So as far as pockets, I'm not worried except for that one tooth I've noted as a 4mm pocket. And then I'm going to look into gingivitis as well. So he's a fairly young dog, so I'm not seeing a ton of gingivitis or even calculus or tartar buildup. Since he was bleeding with probing here, I am going to note that as 1+ gingivitis. And then on his canine as well, V104, I'm going to mark as 1+ gingivitis. But on the 300 side, I think I'll leave it as no, I'm going to put that one as 1 gingivitis as well, just because it was a 3mm pocket. But otherwise, his teeth look pretty good. So now I've counted. This discoloration is going to come off with my scaling, so I'm not worried about it. He does have a fractured tooth that we are dealing with today. It's fractured 204. I don't know if you can see it, but he has a fractured canine tooth. But that's in the 200s, so it's not in what I'm charting, but I know that that is there. Otherwise, he does have some wear on his canines too. His upper 100 isn't worn too much, just the slight rust, like the tip of it. And then he has some wear on his lower incisors as well. So 302 and 3 are both worn. And then as far as calculus goes, again, it's looking pretty good in here. There are a couple teeth where I'm going to note some calculus. So 104 is going to be a C1. Or sorry, we go with slight. Calculus is CS, slight. And then same with my 08, I'm going to say that is slight calculus. Yeah, and this 08 back here is also slight calculus. But this will all clean off nicely with my scaling. All right, so I have assessed for gingivitis, I've assessed for plaque, I've probed, we know about that fractured tooth, and then as far as mobility goes, nothing else is mobile in here. Give a good press on all the teeth, but nothing's moving. All right, so that's the bulk of the charting. So next we are going to do our quick toothbrushing to decrease that bacterial overload. Okay, so we're moving on to the next step, which is going to be a quick toothbrush. This is going to help decrease the bacterial load that he has in his mouth. That is both for his safety and for our safety, so that we're not breathing in any of the aerosolized bacteria, and neither is he. So what I'm going to do is I'm just going to give him a little rinse. And then we're going to give it a little toothbrush on the quadrants that we'll be cleaning. All right, and then we're going to put some gauze in the back of the mouth before we get any more water in there. So I've just got some gauze down the back of the throat. This is another safety feature that we use for the pets so that we can avoid aspiration of any fluids during the dentistry. And at this point, we've done our bacterial underload, so we can move to the scaling. So we always start with the piezo first. And I'm just going to get my pedal and everything together. All right, so with our piezo tip, we're going to hold it in a modified pen grasp, and then we are going to just using the side of the piezo tip and moving over the tooth. We want to focus on it for less than 10 seconds. If we need more than 10 seconds of cleaning, we have to come back to it afterwards. So I'm going to just start with this canine. And then we're going to move down the teeth. And with our piezo tip, we can go subgingivally. So I am going subgingival, and then you're just letting the piezo tip work. And then I'm going to get some incisors as well. And then I'm just going to go back over the teeth that I want to do a little bit more on. So this 08. There's going to be a bit of hand scaling there in that groove that I'm still going to do here. So I'm just going to go make sure there's not too much water in the mouth. And then I'm going to do some hand scaling. So I think I'm going to start with my Gracie curette. And on this canine, I'm just going to be going subgingivally, taking on a bit of that extra calculus on the tooth surface. There's a bit of a ridge on the back of this canine that I'll see if I can smooth down. I'm just smelling some ISO. I don't know if it's just speaking this cup. Otherwise, he's doing good.
It was just a double breath that you had some action.
Sure. So, and then I'm just going to switch to my scaler, my universal here. And again, just going with my hand and getting these grooves cleaned out. So you always want to pull towards the apex of the tooth with this. And then I think I'm just going to go one more time over with this piezo on those two teeth that I've been hand cleaning. And then we should be done on the 100s. All right. So I'm I'm fairly happy with the cleaning of that, but I'm going to go with my Shepherd's Hook Explorer, and I'm just going to give a feel over the tooth surfaces just to make sure I'm happy with how they feel. They should feel like smooth glass. They are feeling pretty nice, so I think I'm going to switch on to the 300 palette. Just going to check my gauze. I think I'm just going to change it out. So this is another way that we're focusing on the patient safety, is making sure that this is always changed out. As well, he's on dry towels. We're going to change this towel out intermittently if it gets wet. He's on a hot dog to keep him nice and warm. All right, so now we're going to switch to doing the 300s here. So I'm just going to get his little tube over this canine and help gig his mouth open a little bit, just for ease of handling. Please, yeah. Thank you so much. I'm craving his other canine. Okie dokie. So we are going to, I have a little towel just to prop him up here, please. Perfect, yeah. All right, so I'm going to be changing positions just slightly to get into this 300 arcade. So that is what we're going to be doing next. So now I'm going to be scaling the lingual 300s. So he's already missing the 04. Thank you. Again, I'm going subgingival with this. And it's a little bit of a struggle to reach those very back winds, but we're just getting the surface in there as well. Alright, so I'm going to go in again with my universal scaler. These teeth really don't look that bad on this lingual surface. The only tooth I'm really going to do anything with is the 08. Just in those grooves. Otherwise, this side looks pretty good. Alright, so that is basically it with my piezo and my hand scaling. I'm pretty happy with where we are at. Okay, so now that I'm done with my piezo tip and my hand scaling, I'm just going to take my Shepherd's Hook Explorer again and check the surfaces on the 300s. Again, they should all feel like smooth glass. Everything feels good in there. So then we are going to move on to the next step, which is prophy. Okay, so we are going to start with the 300 quadrant. So I'm going to take my air and water and quickly rinse it out and then dry it off before the prophy. And then I'm going to get a scoop of my prophy paste here. And then I'm going with my low-speed hand piece. We have the disposable prophy tips already on it. And with this one, I follow the textbook's way of holding just to get into that mouth easier. So I've just loaded up my prophy tip with my prophy paste. And then I'm going to start at the back. And I'm just going to let this do the rotating, press it down a bit slightly on the tooth surface. And this can go slightly subgingival as well. And the same with the piezo, you don't want to spend more than 10 seconds per tooth. And you want to often fill up on your prophy. Alright, so we have prophied all of the lingual 300s, and now we are going to rinse and dry off. Alright, and then I'm going to soak up some of that water that I created in here. Alright, and now we are going to move on to the 300s. So I'm going to take this gag off the teeth, move my tongue back down. I think we're okay still with it there. Thank you. Alright, so now we are going to do the same thing on the 100s. So a quick rinse. My gauze is still dry back at the back of the throat there. So then I'm just going to rinse off the teeth. And we're going to leave them dry before we put the prophy paste on. So again, with my low speed hand piece, I am just going to start my prophy on the back teeth. And then we just have our incisors as well. All right, so now we are going to rinse off all of our cookie paste. All right, and then I'm going to change out the gauze at the back of the throat again. And do a little bit of a dry of the mouth as well. Okay, so now that I am content with my cleaning and pro-feed, all we have left to do is just a bit of a chlorhexidine rinse. Thank you. So we're just going to give a little drizzle onto the teeth that we've cleaned. As a final antibiotic rinse. Okay, so I just wanted to talk about some of the precautions that we take for both ourselves and for the patient. So obviously for myself, I have my full PPE on. Anybody within 3 feet of the dental area should have a mask on and goggles. We're thinking about eye protection for ourselves as well as for our patient. So we want to make sure that we're not spraying directly in their eyes and that they have eye lubrication on at all times. Again, keeping them warm, keeping them dry, avoiding any sort of burns from the hand instruments or from the hot dog itself, reducing the bacterial load, which we did at the very beginning of our dental, keeping all the instruments, handling those carefully. Obviously, they're sharp for both us and for the patient. And using the gauze and the cuff at the back to prevent aspiration I talked about. So I think that's everything. The ergonomics, obviously, I definitely could improve upon that. I know that I wasn't sitting my best, but sitting properly, holding your wrists properly, good lighting, all of that is super important. So I wanted to reiterate that's what was on my mind during the dental. And the final thing is the pencil that I was using for charting gets sanitized, and it's only for charting dentals.